authorization available. I would like to add that not just the pre-authorization part, the whole gambit of services which the customer expects from a TPA or the insurance company expects to facilitate for them, or the provider expects to get from an early authorization and early payment, all are facilitated through the technology platform, wherein all the links between the patient profile, the member profile, the policy details, and the provider network tariff and facilities are linked together to make the claim process in a very seamless fashion and authorization possible in a very quick turnaround time. Going forward also, we have invested a lot in technology, and we are moving towards electronic digitized document management system where we would not be having physical files. Today also all our records, all our systems are connected, and every file, every claim file, every interaction with the customer is recorded in the system and is available to all the stakeholders with a login ID, password. They can click off a button, they can look at the status, look at the claim status, payment status, or develop or download any letter, any authorization letter, or a voucher, or any requirement that can be serviced through the web portal is being provided online.
Great. Stephen, we welcome you from Singapore.
Thank you.
I'm not very...
Sure. I'm Stephen Yeo. Good morning, everyone. I cover basically Asia Pacific of HIMSS, as well as the Middle East. And HIMSS today is entering into our 50 years. All right, so we were formed 50 years ago. And we are a membership organization, cost-based, not for-profit. But we are exclusively focused on providing global leadership in terms of the optimal use of information technology, as well as the management system for the betterment of healthcare. All right, so based on, we definitely are not a solution providers, or neither are we an insurance company. However, we do have more than 28,000 individual members around the world. We have more than 400 corporate members, okay, that is comprises from software, hardware, system integrators, hospitals, as well as insurance companies that are part of our members as well. Okay, more importantly, we also have hospitals now also enter as a membership. I think that creates a lot of education. We actually provide the education. We're also one of the, I would say the only one in terms of healthcare IT professional certifications that we provide in the world. Right, so yeah, there are many projects that we are involved. There are one that is particularly interesting, and that is involved the topics today is, we call it the medical banking, okay, project that HIMSS is leading around the globe with insurance company as well as hospitals.
And can you describe that?
Something pretty new. I think there are two areas that we focus on. One is really on the areas of early prevention. Okay, I think insurance is not because that, okay, you have a problems, okay, you go to hospitals, you go and do the claim. But how we're actually looking at is really that how to actually create that prevention to move care from the hospitals to residential, eventually to homes. And as we help people to manage their hypertension, their chronic disease, and everything else, then they live more healthily, then it also benefits the insurance company. All right, and more importantly, it benefits the patient. Having said that, if the patient who comes in to get treatments, to get stuff, today we look at claim process are pretty cumbersome. Maybe you all can justify that. Okay, hospitals, okay, it's the service providers in terms of getting the claim, all the payments, okay, from the patients, whether through it, their Medisave, through it out of the pocket, through it by something that they pay to the insurance. It's actually a lot of process involved in that. In addition, is that the margin for the hospitals are really, really low. How do we get that payment, okay, in time to actually get back to, from the insurance, the claim, back to the hospital is very important. So medical banking, what we actually do is that we are involved, not the insurance company, we are involving the hospitals, the healthcare service providers. We also involve the patient, but more importantly, we are involving the banks. So the banks, the banks are changing the way they offer services to the hospitals. And I think that is pretty much tied into what our topics today talk about, how you reform, okay, healthcare insurance, but more importantly, how to reform the banking process as well.
Very interesting. Very, very interesting. I just hope your processes don't get too well in, like, extending out into curative and prevention? Because if people are all feeling very well, nobody's going to buy insurance anyways.
Well, as I say, I think this is
not overly successful.
I think this actually helps insurance company because payers is that if the people are living healthily, I think it benefits the insurance as well. Okay, and one thing to clarify, the project is not driven just by HIMSS alone. It's actually driven by the members of HIMSS, right. And they are coming from all the different parts of the ecosystems.
And you know, as we hear from here, like later on towards the end, one thing we would like is maybe I think you would have a lot of experience in the Southeast Asia region. So any other innovative things that are going on which you can share, that would be really great.
Sure.
Yeah. So coming back to my left side, and as a standalone health insurer, you know, the retail business is very, very important. And as in retail business, underwriting becomes very important, you know. And so what's the role of technology in your underwriting function going forward?
Okay, so I'll just talk about the philosophy which Max Bupa has adopted in terms of an underwriting. We underwrite an individual at the point of a sale itself rather than at a point of claim. So that's a major difference. The second aspect is we have one of the channel for selling the policies or managing the prospects is through a telesales. And what we ensure is through a technology, we do a three-way underwriting, wherein a telesales agent, an underwriter, and a customer gets into a call while the policy is being sold. They have a discussion saying what are the pre-existing conditions and whether if there is any exclusions which is to be given, or if there is any medical test to be scheduled, all that get discussed in that three-way call, and customer is made well aware about the exclusions which are being given. So that's about the telesales channel, where the entire channel from an end-to-end processing, including an underwriting, is covered through the technology. Otherwise, without a technology, we wouldn't have been able to do that. If we talk about the other channels through which we handle the underwriting, there is a system which is available which is being used by all our underwriters. There are three objectives of making that system. One is that there is a lot of subjectivity in terms of how a doctor perceives a specific individual. What we have ensured is there is some consistency and less of subjectivity available whenever there is an individual or there is a prospect, and if everybody is looking at that, there is less subjectivity and people have a common platform in terms of a recommendation. That's point number one. Point number two is that wherever feasible, we have tried to rate a risk. So if there is a condition, if there is a pre-existing available, we have tried putting a risk or give a risk rating to that condition so that there is some objectivity which is available. Third and the most important is whenever there are any exclusions which are included in the policy, they are well communicated as part of the welcome kit and they are being informed to the individuals as well. So this is what we have ensured in terms of an underwriting. Whether it is a telesales or any other channel which you are talking about, technology is extensively used, as I said in my first point, whether starting from managing the prospect till the time we actually issue out a policy. So underwriting is part of that.
Ramon, explain that to us, and you know, every user asks for the ROI sort of argument, you know, and so what's the benefit of each stakeholder in terms of an ROI? How do you demonstrate that?
Yeah. We actually convert completely paper-based processes from a fax-based system from a pre-approval. It gets converted onto a completely electronic. The cost per transaction is dramatically come down right from the first pre-auth request that goes in. And more iterations that go between the payer and the provider. There is a definite cost improvement because the cost of communication is via a telephone line or a fax line is compared to an internet is a fraction. So we give a lot of ROI to the payer, and from the provider side, the iterations, the phone calls that he has to make if there's a fax that goes or whether he's received it on time, and of course from the consumer perspective, when he goes into a hospital, he expects that the pre-authorization comes fast so that he doesn't have those critical waiting period and those nervous moments where he's going to get an approval, especially if he's going in, say, for a cardiac or a high-cost surgical procedure where he has to mobilize money in case there is no pre-approval. So I think although there is a B2B flavor in our business model, but I think the consumer is the most important aspect in our whole transaction engine. Yeah.
Great. Sasi, like anybody who's involved in, say, for example, group health insurance, they realize there's a lot of value to data analysis. If I'm a buyer of group health insurance, I have 10,000, 15,000 employees. As an employer, I like to see what's going on and what are the costs which are contributing to premium increases and everything, right? I'm assuming that from the earlier presentation, and also you guys are involved in a large scheme in Tamil Nadu, the data warehousing and analytics would become increasingly more important, right? Can you talk a little bit about that, what sort of roadmap, and we're going to come also address that later on with Ramon too. But can you just talk about in your entity, what's the role of data warehousing and analysis, and what's the level that you're currently doing?